Hey everyone! Welcome to Medical Interview Simulation in English. Today we're going to practice medical interviews based on questions from the Japanese National Medical Examination. We'll turn these exam questions into real-world conversations between Dr. Satomi as the physician and Umi Yamazato as our patient. I'm Yamato, and I'll be your guide through this practice session. Our goal is to help healthcare professionals get better at talking with patients through these realistic scenarios. Alright, for today's practice, we're using a case from the National Medical Exam. Let me introduce Umi-san, who is an 80-year-old female. We'll see how Dr. Satomi handles this consultation.
Hi Umi-san, I'm Dr. Satomi. Thanks for coming in today. What brings you in?
Well, I fainted, you know. My family found me on the living room floor and called an ambulance.
I see. That must have been scary. Are you feeling okay now?
Yeah, I woke up before they got here. Bit shaken up, though.
Understandable. So before you fainted, had you been feeling unwell?
Yes, I've had this cough for about a month now, and I get out of breath really easily. Just walking 5 meters, makes me puff.
A cough and shortness of breath. Anything else been bothering you?
No fever or chest pain, but I did notice I've gained about 3 kilos in the last month.
Okay, weight gain too. Let me just make sure I've got this right. You've had a cough and shortness of breath for a month and recently gained weight, then fainted today. Is that correct?
Yes, that's it.
Have you had anything like this before?
No, not really. I mean, I've had coughs before, but not with this shortness of breath.
Got it. Now, tell me a bit about your medical history. Do you have any conditions we should know about?
I have high blood pressure and I take medicine for it, and for insomnia too.
Okay, high blood pressure and insomnia. Are you taking your medications regularly?
Yes, every day.
Good. Any allergies?
No, not that I know of.
All right. Let's talk a little about your life at home. You mentioned you live with your family?
Yes, my son and his wife and my 3 grandkids. My husband passed away 8 years ago.
I'm sorry to hear that. How has this shortness of breath been affecting your daily life?
It's hard to do much. I get tired so quickly. I used to be more active,
I can imagine. Do you have help around the house?
My family helps out, but I still try to do what I can.
You're doing a great job managing things. Feeling out of breath like this can be worrying. How has it made you feel emotionally?
A bit down, to be honest. It's frustrating not being able to do things I used to.
It's completely understandable to feel that way. Well, Umi-san, we're going to run some tests to get to the bottom of this. You did the right thing coming in. So, to summarize, you came in today after fainting. You've been experiencing a cough, shortness of breath, and recent weight gain for about a month. You have high blood pressure and insomnia for which you take medication. You live with your son's family and are finding it difficult to manage your daily activities due to shortness of breath. We'll get you checked out and figure out what's going on.
Great job, Dr. Satomi. You covered all the key points: the main complaint, timeline, related symptoms, medical history, and even the psychosocial context. You used open-ended questions, active listening, affirmation, and confirmation to really understand Umi-san's situation. Remember, the primary goal in history taking is to build a complete picture of the patient's situation in their own words. By using open questions and techniques like active listening and affirmation, you can gather essential information and make the patient feel heard and understood. And that's a wrap for today's medical interview simulation in English. Thanks for practicing with us, and we'll catch you next time. Hey, if you want to check your answers, head over to the National Medical Exam question 180A34. That's where you'll find all the details.